Short to Walker, and the Blues trying to get off half back, and they will through McLean.
So McLean over the top.
He's hurt, Ed. Walker's hurt.
Watch him land. Props. Oh, boy. You just saw it go there.
It's a free kick. So it's the
hyperextends.
Hyperextends.
Ugly to look at.
And it's almost a trampoline-like effect.
So all you can do is cross the fingers and hope that...
Oh my god, did he just break his leg?
I don't know, it looked like he dislocated his knee.
Maybe he twisted his ankle.
Yeah, the commentator wasn't too clear. We'll have to wait and see. Welcome back and good afternoon. What a busy week of football we've had. The Crows captain and number one full forward has ruptured his right ACL. He will undergo a new reconstruction later this week and then begin his rehabilitation to build full strength in his right knee again. We're all hoping for a speedy recovery. I welcome two medical professionals to the show, Dr. Alicia and Steph, who are the health professionals of the Crows Football Club. Alicia.
Thanks, Matt, and good afternoon, everyone. I'm Dr. Alicia, and this is Steph. We're going to be explaining this injury further to you all today. Before we can explain this, let's take a closer look at the moment of impact.
In this video, the main movements occurring at the knee joint are flexion and extension. These movements occur in the sagittal plane, having a frontal axis of rotation. As you can see here, upon landing on his right leg, Taylor Walker has hyperextended his tibiofemoral joint with an inversion of the talocrural joint, causing the anterior cruciate ligament to tear.
Hello, I'm Steph and I'm the physiotherapist for the Crows Football Club. Today I will step by step show you the anatomy of the knee and how it functions as a hinge joint. The knee joint is also known as the tibiofemoral joint. The tibiofemoral joint contains three bones, and they are the femur, the tibia and the fibula. Connecting those three bones are ligaments. They are the lateral collateral ligament, the medial collateral ligament, the anterior cruciate ligament running obliquely, and the posterior cruciate ligament.
The anterior cruciate ligament prevents the femur from sliding posteriorly and also restricts the tibia from sliding anteriorly. It attaches to the anterior intercondylar region of the tibia, ascending posteriorly to attach onto the intercondylar fossa of the femur. The posterior cruciate ligament limits the femur from sliding anteriorly on the tibia and prevents the tibia from sliding posteriorly on the femur. It attaches to the posterior intercondylar region of the tibia, ascending anteriorly to attach onto the intercondylar fossa of the femur. The anterior cruciate ligament and posterior cruciate ligament can also be referred to as cruciform ligaments, as they are arranged in a cross formation. There are two collateral ligaments in the knee, the medial collateral ligament and the lateral collateral ligament. They are both involved in preventing the femur from sliding medially and laterally. The medial collateral ligament attaches to the medial epicondyle of the femur and inserts onto the medial surface of the tibia head. The lateral collateral ligament attaches to the lateral epicondyle of the femur and inserts onto the lateral surface of the fibular head. As previously discussed, Taylor Walker ruptured his anterior cruciate ligament. This ligament can be damaged or torn by rotational stress, for instance, a change in direction on a locked knee or hyperextending the knee. The muscles of the knee are responsible for flexion, extension and stabilization of the knee joint, which allow for important movements such as walking, jumping, running and kicking. Those muscles include the anterior compartment of the thigh, also known as the quadricep muscles, the posterior compartment of the thigh, also known as the hamstring muscles, and the calf muscles. There are four muscles of the anterior compartment of the thigh that contribute to movement of the tibiofemoral joint by extending the leg at the knee and flexing the thigh at the hip. These are vastus lateralis, vastus medialis, vastus intermedius, which is deep to rectus femoris. The following shows the insertions, origins, nerve innervation and blood supply to these muscles.
posterior compartment of the thigh that work together to flex the leg at the tibiofemoral joint. They are biceps femoris, which has both a long and short head, semimembranosus, and finally semitendinosus. The following shows the origin, insertion, blood supply, and nerve innervation of these muscles. The main muscle in the lower leg region is the gastrocnemius muscle, which acts in plantar flexion of the ankle and flexion of the tibiofemoral joint. This also shows the origins, insertion, blood supply, and nerve innervation of this muscle.
Other muscles that assist with knee movements are the popliteus and tensor fasciae latae muscles. The popliteus muscle is involved in flexion of the knee and medial rotation of the tibia. Finally, the tensor fasciae latae muscle works to contract the iliotibial band of the fibrous connective tissue that stabilizes the femur, tibia, and thigh muscles. Each muscle mentioned contributes to knee mobility such as flexion and extension. However, none of these muscles are damaged when an individual tears their anterior cruciate ligament.
Magnetic resonance imaging, also known as MRI, has led to an incredible advancement in regards to diagnosis of soft tissue injuries. It is a technique that uses radio waves and a magnetic field to detect abnormalities within soft tissue structures. This image shows a T2 weighted MRI of the knee from a mid-sagittal view. In both T1 and T2 weighted MRIs, the anterior cruciate ligament is a void and oblique structure. A standard ACL tear is detected by the loss of the normal void signal. Instead of a void structure, the anterior cruciate ligament illustrates a bright signal on an MRI. This is due to an assemblage of debris and disrupted ligament fibers accompanying a hemorrhage within the tibiofemoral joint. The most common repair method for the anterior cruciate ligament is arthroscopic surgery. This is the method Taylor Walker's orthopedic surgeon used and is shown in this video. This is usually done by making small incisions around the knee, allowing access for small instruments to reconstruct the ruptured ligament. The surgeon will most likely use a grafting method where a piece of tendon is taken from another part of the knee to act as a new ligament. The second method may be open surgery. However, this is often avoided by orthopedic surgeons because arthroscopic surgery has fewer risks which are associated with open surgery. For example, the greater susceptibility to infection. Once the appropriate technique has been selected, in this case arthroscopic surgery, the incisions will be made and then pumped with sterile saline. At this point, the opening will have expanded and the blood washed from the area, which increases the visual of the knee structure. The arthroscope is inserted into one of the incisions, which is then transmitted to a TV monitor, allowing the surgeon to view inside the knee. The damaged anterior cruciate ligament is located and detached to make way for the replacement ligament. The surgeon begins the procedure by drilling into the femur on the lateral side of the femoral condyle and the medial condyle of the tibia, forming tunnels which allow for the attachment of the new ligament. The graft is taken commonly from the patellar tendon or the semimembranosus tendon. In this particular case, Taylor Walker's surgeon used the semimembranosus tendon from a deceased donor. The tendon is then anchored from the lateral side of the femoral condyle to the medial condyle of the tibia, acting as the new anterior cruciate ligament. Physiotherapy may start 2 to 4 weeks after the surgery, and then the rehabilitation process can take from 2 to 6 months after the surgery.
Thank you very much for that in-depth insight, ladies. It was very educational, and I think we learned a lot from that one. Unfortunately, it means Taylor Walker will be out for the rest of the season, but we wish him a speedy recovery. That's all for tonight's show, and thanks for watching.